Hello, my name is Amy Sturkey. I am a pediatric physical therapist. I'm here with Myla. How old is Myla now? She's 7 years old. And Maycie, how old are you now?
10.
10, and Maycie. Myla is still working on her articulation. She has low tone, she has Down syndrome, and how loud she can speak and just the articulation of how she speaks. And a lot of times children who are low tone have poor awareness of where their mouth is, and that makes it hard for them to figure out how to articulate things. So one of the things you can do is do oral sensory stimulation. So one of the simplest ones is simply taking something like a Nook. Let's see what this brand is. Can I see for a second? And this one's an Arx probe. There are different brands of these on the market, but they are made to do oral stimulation. So the simplest one, can you have it's called a Jumbo Mighty Mouth. This is by Super Duper, and it's great for being able to demonstrate what you're going to do. So I'm going to take my Nook and just do the top, what is that, right-hand side of the mouth, the top left-hand side of the mouth. This is on the lips. The bottom left and the bottom right. All right, so this one's yours. I'm gonna do this with you. Can you open up your mouth for me? I'm gonna do the top right, the top left, the bottom left, and the bottom right. How did that feel? Kind of strange. All right, hold this right here. All right, so we're gonna do the same thing. This one's, like I say, the Arx probe, and we're gonna try it with Myla. You ready? Right here on this side. Now, each one of these kind of have different textures. This one's not as intense as some of the other ones. This side. 2, bottom here, 3, 4. Now, Myla was pretty tolerant of this. For some kids, that you do one side and they're like, whoop, 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 whoop. You have to give them a high five before you go on to the next stage. But this is the very beginningest and earliest of these. I used a rolling technique. If I slid along her lips, let me see, right here. If I slid along her lips, that would be a little bit more intense as opposed to the roll. So there's, according to how you roll or you slide along or what the texture is of the Nook that you use, they come in all sorts of different textures. Sometimes kids like seeing what you're going to do beforehand to prep them a little bit. Sometimes having a sibling do it helps. In any case, it's a way to work on oral sensitivity and oral awareness so that they can be more aware of where their mouth is, because clearly when you talk, your mouth has to move. Hope this is helpful, and we'll look forward to seeing you next time. Thanks a lot. Bye-bye. If you liked this video and would like to be notified by email when the next video comes out, click the subscribe button here and click the golden bell icon and ensure notifications are enabled on your account.